Hello friends, you are all welcome to Human Bee. In this video, we are going to discuss about the muscles of the wrist complex. The primary role of the muscles of the wrist complex is to provide a stable base for the hand. That is, the muscle requires an optimum length to produce maximum tension. If a muscle is lengthened or shortened, the efficiency of that particular muscle decreases. That is, if you want to hold an object, first of all your wrist has to be stabilized, then only the finger muscles can perform that particular function. If the wrist is not stabilized, the finger muscles either shortened or lengthened and the grip will not be that much efficient. The wrist stabilization is mainly provided by the muscles and that will maintain the correct length tension relationship. In this figure you can see that the wrist and finger flexors are lengthened, and in the second figure you can see the wrist and finger flexors are shortened, and in the third figure you can see the wrist is stabilized and thereby the length of the tendons are maintained, so you will get a strong and tight grip. So this wrist stabilization is very important for performing a particular function, and this stabilization is mainly done by the wrist musculature. Next we will discuss the volar wrist musculature. In the volar aspect of the wrist, there are mainly 6 flexors. The muscles are palmaris longus, flexor carpi radialis, flexor carpi ulnaris, flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus. In this, first 3 muscles are primary wrist flexors. That means these muscles primarily acting on the wrist joint, and the last 3 are flexors of the digits. That is, they are mainly acting on the fingers and thumb, but they have got some secondary action on the wrist joint that will produce flexion in the wrist joint, but they are primarily acting on the digits and thumb. At the wrist level, all the volar wrist muscles pass beneath the flexor retinaculum along with median nerve except palmaris longus and flexor carpi ulnaris. In this figure you can see that the flexor tendons are passing beneath the flexor retinaculum with median nerve, and you can also see the flexor carpi ulnaris and palmaris longus are outside the flexor retinaculum. They are not passing beneath the flexor retinaculum. The flexor retinaculum prevents the bowstringing of the long flexor tendons, thereby maintaining an appropriate length tension relationship. That means because of the flexor retinaculum, flexor tendon won't pop up or get twisted. The correct length is maintained by the flexor retinaculum, thereby maintains the length tension relationship of tendons. The distal portion of flexor retinaculum is commonly known as transverse carpal ligament. You can also see palmar cutaneous branch of median nerve runs above flexor retinaculum. This nerve supplies thenar remnants and it is not affected in carpal tunnel syndrome. Carpal tunnel syndrome is the compression of median nerve in carpal tunnel. So this nerve won't be affected in carpal tunnel syndrome because it is passing above the flexor retinaculum. Next we will discuss palmaris longus. The origin is from medial epicondyle of the humerus and it is inserted to palmar aponeurosis of the hand. The nerve supply is median nerve and the action is flexion of the wrist joint. The palmaris longus muscle is a wrist flexor without producing either radial or ulnar deviation because this muscle is inserted more towards the center. So it is a wrist flexor without producing either radial or ulnar deviation. This muscle and tendon are absent unilaterally or bilaterally in approximately 14% of people without producing any strength or functional deficit. Next muscle is flexor carpi radialis. This muscle originates from medial epicondyle of the humerus and it is inserted to base of second and third metacarpal. The nerve supply is median nerve and the action is flexion and abduction of the wrist, or you can say flexion and radial deviation of the wrist. This muscle is not an effective radial deviator because it is inserted to base of second and third metacarpal. This places it in line with long axis of the hand. That means its insertion is more towards the center, so it is not an effective radiodeviator. Along with palmaris longus muscle, the flexor carpi radialis muscle function as a wrist flexor with little amount of radiodeviation. Next muscle is flexor carpi ulnaris. The humeral head originates from medial epicondyle of the humerus and ulnar head originates from olecranon and posterior border of the ulna. This muscle inserted to pisiform bone and then via piezohamate and piezometacarpal ligament into hamate and base of fifth metacarpal. The nerve supply is ulnar nerve and the action is flexion and adduction of the wrist joint, or you can say flexion and ulnar deviation of the wrist joint. This muscle envelops the pisiform. It is a sesamoid bone that will increases the momentum of this particular muscle. Flexor carpi ulnaris can act on hamate and fifth metacarpal indirectly through the pisiform ligaments, and it will produce flexion and ulnar deviation of the wrist joint. Flexor carpi ulnaris tendon crosses the wrist joint at a greater distance from the axis for wrist, radial and ulnar deviation. That means this muscle is placed more medial towards the wrist joint, so it is an effective ulnar deviator. Now we discussed three muscles that is primarily acting on the wrist joint. Next we are moving to the muscles that is primarily acting on digits. But these muscles are passing volar to the wrist joint, so that will produce some amount of flexor force in the wrist. First muscle is flexor digitorum superficialis. This muscle has got two heads of origin. The humero-ulnar head originates from medial epicondyle of the humerus and adjacent margin of coronoid process. Radial head originates from oblique line of radius. And it is inserted as fore tendon and it is attached to middle phalanx of index, middle, ring and little fingers. The innervation is median nerve and the action is it flexes the proximal interphalangeal joint of index, middle, ring and little fingers, and it can also flex metacarpophalangeal joint of the same fingers and the wrist joint. Flexor digitorum superficialis is more effective in producing wrist flexion than flexor digitorum profundus, because flexor digitorum profundus is a deeper muscle and that will cross more joints and is therefore more likely to be actively insufficient. Next muscle is flexor digitorum profundus. This muscle originates from anterior and medial surface of ulna and anterior medial half of interosseous membrane. It is inserted as fore tendons which attaches to the distal phalanx of index, middle, ring and little fingers. The nerve supply is, the lateral half is supplied by median nerve, medial half is by ulnar nerve. Function is, it flexes the distal interphalangeal joint of the index, middle, ring and little fingers, and it can also flex metacarpophalangeal joints of same fingers and the wrist joint. This muscle is passing volar to the wrist joint, so that will produce some amount of flexor force on the wrist joint. Next muscle is flexor pollicis longus. Flexor pollicis longus originates from anterior surface of radius and radial half of interosseous membrane. It is inserted to the base of distal phalanx of the thumb. The nerve supply is median nerve, that is anterior interosseous nerve, and the action is it flexes the interphalangeal joint of the thumb and it can also flex metacarpophalangeal joint of the thumb. The flexor pollicis longus muscle has got an effect on the wrist because the position of the tendon suggests the ability to contribute both flexion and radial deviation of the wrist, because this muscle is inserted to the distal phalanx of the thumb, that is it is inserted more towards the radial side, so that will produce some amount of radial deviation if more distal joints are stabilized. So flexor pollicis longus will produce both flexion and radial deviation of the wrist joint. Next we will discuss Dorset wrist musculature. The dorsum of the wrist complex is crossed by tendons of 9 muscles. 3 of the 9 muscles are primarily wrist muscles. That means they are primarily acting on the wrist. These muscles are extensor carpi radialis longus, extensor carpi radialis brevis, extensor carpi ulnaris. These three muscles primarily acting on the wrist joint. The other 6 muscles are finger and thumb muscles. That means they are crossing the dorsal aspect of the wrist, so they have got secondary actions on the wrist, but they are primarily acting on the fingers and thumb. The muscles are extensor digitorum communis, extensor indicis proprius, extensor digiti minimi, extensor pollicis longus, extensor pollicis brevis, and abductor pollicis longus. The tendons of all 9 muscles pass under extensor retinaculum. In this figure you can see that all the 9 muscles tendons are passing under extensor retinaculum. As the tendons pass deep to the retinaculum, each tendon is covered by their own tendon sheath, and this will prevent the friction between tendon and the retinaculum. Next we will discuss the muscles that is primarily acting on the wrist joint. They are extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris. First we will discuss extensor carpi radialis longus. The origin is from lateral supracondylar ridge of the humerus and adjacent intermuscular septum. It is inserted to base of second metacarpal. You can see it is inserted to base of second metacarpal. And nerve supply is radial nerve, and the action is it produces extension and abduction of the wrist. Next muscle is extensor carpi radialis brevis. The origin is from lateral epicondyle of the humerus, or you can say common extensor origin, and adjacent intermuscular septum, and it is inserted to base of third metacarpal, and nerve supply is radial nerve, and the action is extension and abduction of the wrist, or you can say extension and radial deviation of the wrist. Extensor carpi radialis brevis muscle is smaller than extensor carpi radialis longus. But this muscle has got a more central location. You can see extensor carpi radialis brevis is inserted to third metacarpal, and extensor carpi radialis longus is inserted to second metacarpal. So you can say extensor carpi radialis brevis has got a more central location. So this muscle generally shows more activity during wrist extension. Extensor carpi radialis longus inserted to second metacarpal, that is, it is inserted to more radial side. Therefore, it has got a smaller momentum for wrist extension than extensor carpi radialis brevis muscle. Next, we will discuss extensor carpi ulnaris. The origin is from lateral epicondyle of the humerus and posterior border of ulna. It is inserted to base of fifth metacarpal. You can see it is inserted to medial side of base of fifth metacarpal. And nerve supply is posterior interosseous nerve, and the action is extension and adduction of the wrist, or you can say extension and ulnar deviation of the wrist. Extensor carpi ulnaris muscle extends and ulnarly deviates the wrist. It is active not only in wrist extension but also in wrist flexion. So this muscle is active both in wrist extension and wrist flexion. The connection of extensor carpi ulnaris tendon sheath to triangular fibrocartilage complex tether the extensor carpi ulnaris muscle and prevent loss of exertion efficiency that would occur with bowstringing. We already discussed in the previous videos, extensor carpi ulnaris muscle has got a attachment with triangular fibrocartilage complex. This maintains the efficiency of this particular muscle. Now we discussed the muscles primarily acting on the wrist joint. Next we are moving to the muscles that is primarily acting on fingers and thumb. But these muscles passes Dorset to the wrist joint, and that will produce secondary actions in the wrist joint. First muscle is extensor digitorum communis. The origin is from lateral epicondyle of the humerus, that is common extensor origin, and adjacent intermuscular septum, and it is split into 4 tendons and inserted via dorsodigital expansion to middle and distal phalanx of fingers. You can see that this muscle is inserted to middle and distal phalanx of fingers. The details of dorsal digital expansion I will explain in the next video. The nerve supply is posterior indocious nerve, and the action is it produces extension of index, middle, ring and little fingers, and it can also extend the wrist. Extensor digitorum communis is a finger extensor muscle but functions also as a wrist extensor because this muscle passes dorsal to the wrist joint and that will produce wrist extension. Next muscles are extensor indicis proprius and extensor digiti minimi. First we will discuss extensor indicis. The origin is from posterior surface of ulna and adjacent indocious membrane, and it is inserted to extensor hood of index finger. The nerve supply is posterior indocious nerve and the action is it extends the index finger. Next muscle is extensor digiti minimi. The origin is from lateral epicondyle of the humerus and adjacent intermuscular septum, and it is inserted to extensor hood of the little finger. Nerve supply is posterior indocious nerve and the action is it extends the little finger. The extensor indicis proprius and extensor digiti minimi muscles are capable of extending the wrist, but wrist extension is credited more to the extensor digitorum communis muscle. Next we will discuss the extrinsic thumb muscles. They are abductor pollicis longus, extensor pollicis brevis and extensor pollicis longus. These muscles crosses the wrist joint and has got secondary actions in the wrist. First we will discuss abductor pollicis longus. The origin is from posterior surface of ulna and radius, and it is inserted to base of first metacarpal. Nerve supply is posterior indocious nerve and the action is it abducts carpo-metacarpal joint of the thumb. Next muscle is extensor pollicis brevis. The origin is from posterior surface of the radius and it is inserted to proximal phalanx of the thumb. Nerve supply is posterior indocious nerve and the action is it extends metacarpophalangeal joint of the thumb and also carpo-metacarpal joint of the thumb. The last muscle is extensor pollicis longus. The origin is from posterior surface of ulna and it is inserted to base of distal phalanx of the thumb. The nerve supply is posterior indocious nerve and the action is it extends interphalangeal joint, carpo-metacarpal joint and metacarpophalangeal joints of the thumb. So these are the extrinsic thumb muscles. Three extrinsic thumb muscles crosses the wrist. Both abductor pollicis longus and extensor pollicis brevis are capable of radially deviating the wrist. You can see that these muscles are radially placed, so they have got an ability to radially deviate the wrist. We already discussed abductor pollicis longus and extensor pollicis brevis has got a capacity to radially deviate the wrist. So in order to offset this unwanted wrist motion, we need a synergistic contraction of extensor carpi ulnaris muscle. When muscles producing ulnar deviation are absent, this thumb extrinsic muscle may produce radial deviation deformity at the wrist. So you need synergistic action of extensor carpi ulnaris muscle to offset the unwanted radial deviation force that is produced by abductor pollicis longus, extensor pollicis brevis and extensor pollicis longus. Thank you.